1. PBM reform. How new laws in Illinois and Congress could lower your prescription costs. 2. Bipartisan effort to reform PBM practices. What you need to know. 3. Congressman Vicente Gonzalez champions PBM Reform Act for South Texas. Full details. 1. PBM reform. How new laws in Illinois and Congress could lower your prescription costs. Imagine a scenario where the very entities designed to reduce healthcare costs might actually be contributing to the problem. This is the crux of the debate surrounding pharmacy benefit managers, PBMs, and it's gaining traction on both state and federal levels. Providers and pharmacies are sounding the alarm, claiming that these middlemen are compromising patient care, while insurers and employers still lean on PBMs to trim down the expenses of drug benefits. On July 1st, Illinois took a significant step forward by enacting the Prescription Drug Affordability Act, a law that imposes strict regulations on PBMs. These managers, who negotiate drug prices on behalf of health insurance plans and develop formularies that often favor cheaper medications, now face new limitations. The Illinois law, inspired by similar measures in other states, explicitly forbids PBMs from steering patients towards pharmacies in which they or their health plan owners have a financial stake. A recent analysis by the American Medical Association, AMA, reveals that the top 3 PBMs, CVS Caremark, OptumRx, and Express Scripts, dominate the market, each vertically integrated with major health insurers. This concentration of power raises concerns about conflicts of interest and market manipulation. One of the key provisions of the Illinois law is the prohibition of spread pricing, a practice where PBMs charge health plans more for prescription drugs than the negotiated rates with pharmacies. By eliminating this middleman markup, the law aims to ensure fairer pricing and better patient outcomes. To further support local pharmacies, the Illinois law introduces a $15 annual fee per person covered, starting in 2026. This fee will generate $25 million annually to assist smaller, independent pharmacies that have been struggling due to the dominance of large retail chains and PBMs. But here's where it gets controversial. The Pharmaceutical Care Management Association, PCMA, the trade group representing PBMs, has strongly criticized the new law. They argue that it will hinder employers' ability to offer affordable health benefits and increase healthcare costs for everyone. The PCMA claims that the legislation imposes an unfair tax on patients and health plan sponsors, limiting their choices and removing valuable tools that help lower prescription drug costs. On the national stage, Congress is considering a bill that mirrors the efforts of states like Illinois. U.S. Representatives Raja Krishnamurti, Democrat Illinois, and Earl Buddy Carter, Republican Georgia, along with 9 other representatives, have introduced the Bipartisan PBM Reform Act. If enacted, this legislation would ban spread pricing in Medicaid and establish a more transparent system to ensure fair reimbursement for pharmacies serving Medicaid beneficiaries. The bill also proposes policies to decouple PBM compensation from drug costs and enhance transparency through semi-annual reports on drug spending, rebates, and formulary decisions. A recent Federal Trade Commission, FTC, report highlighted that PBMs often favor their own pharmacies and significantly mark up the prices of specialty generic drugs, such as those used to treat HIV, cancer, and other serious conditions. However, the PCMA remains steadfast in its opposition, arguing that the real issue lies with Big Pharma, which sets and raises drug prices. They contend that the numerous state laws regulating PBMs since 2016 have not resulted in lower drug costs and suggest that lawmakers should focus on the entire prescription drug supply chain, particularly the drug manufacturers. Employers, who depend on PBMs to manage the rising costs of prescription drug benefits, are increasingly scrutinizing their relationships with these middlemen. According to a survey by Gallagher, a health benefits broker based in Rolling Meadows, 32% of employers are exploring ways to revise their PBM contracts or seek alternative partners to optimize their drug spending. What do you think? Should the government regulate PBMs more strictly, Or is the focus on Big Pharma a more effective approach to lowering drug costs? Share your thoughts in the comments below. 2. Bipartisan effort to reform PBM practices. What you need to know. Legislators from both sides of the aisle are reigniting the debate over pharmacy benefit manager, PBM, reforms on Capitol Hill. Despite the fact that significant PBM reform was omitted from the Big Beautiful Bill, a bipartisan coalition of representatives has stepped forward with new legislation targeting the PBM industry. Led by Republican Representative Buddy Carter from Georgia, the PBM Reform Act aims to prohibit the use of split pricing models in Medicaid programs. Instead, it proposes a shift towards a more transparent system, ensuring that pharmacies receive fairer reimbursement for their services. This shift is crucial because it addresses a common complaint from pharmacists who feel they are being underpaid for the vital work they do. Moreover, the bill seeks to decouple PBM compensation from the cost of medications within Medicare Part D, and it mandates semi-annual reports that offer deeper insights into spending, rebates, and formulary decisions. These reports are designed to provide plan sponsors and members with clearer information, making the entire process more accountable and understandable. But here's where it gets controversial. While the idea of reforming PBMs has historically garnered support from both Democrats and Republicans, actual legislative progress has been slow and often stalls in Congress. Many stakeholders, including healthcare providers and patient advocates, are eager to see real change, but the powerful lobbying efforts from PBMs can be a significant obstacle. Representative Carter's bill also calls for the Centers for Medicare and Medicaid Services, CMS, to implement and enforce contract terms in Part D that are reasonable and relevant. This includes increasing oversight to detect and address potential violations. In a press release, Carter criticized the vertical integration within the PBM industry, calling for an end to what he sees as a monopolistic control. However, the bill stops short of breaking up these companies, which some critics argue might be necessary for true reform. The PBM market is dominated by three major players: CVS Caremark, Express Scripts, and OptumRx. Each of these companies is closely tied to a large national insurer, Aetna, Cigna, and United Healthcare, respectively. This vertical integration has raised concerns about conflicts of interest and unfair practices. As a pharmacist, I've witnessed firsthand how PBMs exploit patients and undermine the healthcare system, Carter stated. Our bipartisan package introduces transparency, competition, and accountability, which are essential to curing this systemic issue. The bill has gained initial co-sponsorship from a diverse group of representatives, including Debbie Dingell, Democrat Michigan, Greg Murphy, Republican North Carolina, and several others from both parties. Dr. Greg Murphy, a physician and co-sponsor, emphasized the long-standing issues with PBMs. We've heard countless stories from small business owners, doctors, and patients about the harm caused by greedy PBMs, he said. This bipartisan legislation is a step towards ending the exploitation and lowering drug costs through greater transparency and competition. And this is the part most people miss. While the bill focuses on transparency and fairer practices, it also highlights the broader need for systemic changes in the healthcare industry. The debate over PBM reform is not just about one sector, it's a microcosm of the larger challenges in healthcare, including access, affordability, and equity. What do you think? Should PBMs be broken up entirely, or is increased transparency and oversight enough to address the issues? Share your thoughts in the comments below. 3. Congressman Vicente Gonzalez champions PBM Reform Act for South Texas. Full details. Press release. Congressman Vicente Gonzalez unveils bipartisan PBM Reform Act to safeguard patients and pharmacies in South Texas. By Quiver Congress Radar. Posted 22 hours ago, July 17, 2025, 8:26 p.m. Universal Time Coordinated. In a significant move to protect the health and well-being of South Texas residents, Congressman Vicente Gonzalez has introduced the Bipartisan PBM Reform Act. This legislation is designed to shield patients and pharmacies from detrimental practices that have been affecting their access to affordable medications. *** Quiver AI Summary ***. Congressman Vicente Gonzalez, representing Texas's 34th District, has put forth H.R. 4317, known as the PBM Reform Act. This important bipartisan initiative aims to impose regulations on pharmacy benefit managers, PBMs, entities that play a crucial role in the healthcare system. The proposed bill seeks to eliminate the controversial practice of spread pricing within Medicaid, ensure that pharmacies receive fair compensation for their services, and enhance price transparency for both patients and employers. Additionally, it calls for more stringent oversight from Medicare to ensure accountability. Gonzalez has been vocal about the negative impact of PBMs on drug pricing, asserting, "Pharmacy benefit managers are profiting at the expense of patients, inflating the costs of essential medications." Co-sponsor Congressman Buddy Carter has echoed this sentiment, emphasizing the urgent need for transparency and competition to rectify the challenges posed by PBMs. This reform initiative has attracted a wide array of original co-sponsors, showcasing a collective commitment to revamping the pharmacy industry. Currently, a mere 3 companies dominate 80% of the prescription drug market, a situation that has led to soaring costs and the unfortunate closure of many pharmacies across the nation. ***, Vicente Gonzalez's legislative proposals ***. In addition to the PBM Reform Act, Congressman Vicente Gonzalez has recently proposed several other bills aimed at improving various sectors. H.4449 This bill seeks to amend the Securities Exchange Act of 1934, establishing offices of small business within the rulemaking divisions of the Securities and Exchange Commission. The goal is to enhance coordination on rules and policy priorities that relate to capital formation. H.1791 known as the Increasing Credit Union Lending for Business Growth Act. This legislation aims to boost lending capabilities for credit unions, thereby fostering business expansion. H.507 This is the Veterans Member Business Loan Act, which focuses on providing financial support to veteran-owned businesses. For those interested in tracking the legislative efforts of Vicente Gonzalez, you can visit Quiver Quantitative's politician page dedicated to him. ***, Vicente Gonzalez's fundraising efforts ***. Recently, Vicente Gonzalez reported a fundraising total of $464.6 thousand in a Q2 FEC disclosure submitted on July 15, 2025. This amount ranks as the 175th highest among all Q2 reports this year, with 65.7% of the funds coming from individual donors. In terms of expenditures, Gonzalez disclosed spending of $104.2 thousand, which places him at the 493rd position among politicians spending reports for Q2 this year. At the end of the reporting period, he had $932.4 thousand in cash on hand, ranking 315th in terms of available funds. For further details, you can view the full disclosure or monitor Vicente Gonzalez's fundraising activities on Quiver Quantitative.